This patient, you can see that the carcinoma is present over the lower lip. So generally in the lip, what is the most common site of carcinoma is the lower lip. Why? Lower lip is most common site in lip because this lower lip is more everted, and that's why it is exposed to sunlight, so there is greater exposure to ultraviolet radiation. And generally this carcinoma lip is more common in males. Why? Because males are involved in outdoor activities. So see the important points related to carcinoma lip. Okay, so first, what's the most common site? It's the lower lip. Why? Because lower lip is exposed to sunlight and it's exposed to ultraviolet radiation. It is more common in males. Why? Because males are involved in outdoor activities. Generally, in which decade? It is seen in 4th to 7th decade. Seen in 4th to 7th decade. Now see, generally these patients have this kind of swelling, growth, sometimes ulceration over the lower lip. Now, we discussed that if the malignancy is arising from upper lip, what? There is lymph node involvement of one side. Why? Because here it is divided by philtrum. But if patient is having malignancy in the lower lip, what happens? Because of crisscross connection, there can be involvement of bilateral cervical lymph node. So here also there can be involvement of cervical lymph node. We discussed that lymph node metastasis is most common with which malignancy? Carcinoma tongue. And it is least common with which malignancy? Carcinoma lip. If carcinoma lip is not given the option, then you have to go for carcinoma heart barrel. So lymph node metastasis is least commonly associated with CLA. And generally these patients are coming to you with lymph node metastasis when the malignancy is highly advanced. Now which group can you see? Most commonly involved with this one submental and this one submandibular. Okay. So clinical presentation, we discussed there is swelling or ulceration. Clear? Generally, if malignancy is in the lower lip, it can lead to bilateral lymph node involvement. And the most commonly involved group of lymph node only seen in advanced malignancies. Lymph node involvement is seen in advanced malignancies. And the involved group is 1A, that is submental, and 1B, and that's submandibular. Clear? So it's submental and submandibular. Clear? Rest of the things are very similar to any other malignancy, like investigation of choice for diagnosis, H biopsy, investigation of choice for staging, MRI, treatment for T1, T2, surgery is sufficient almost. So surgery alone is sufficient in majority of cases. And for T3, T4, we give surgery plus radiotherapy. Okay. Now see what kind of treatment is done in CLA. So treatment, if patient is having T1 and T2 tumors, here surgery alone. And if patient is having T3 and T4, here we go for surgery plus radiotherapy. Clear? Now what kind of surgery? If less than 1/3 of lip is involved, in that case you can go for V-shaped or W-shaped excision with primary closure. And if more than 1/3 of lip is involved, in that case you have to go for excision and you have to go for flap closure. And what is the most commonly used flap in lip reconstruction? So we use Abbé East-Landers flap, and it is taken from upper lip based on superior labial artery. Okay, so see, two situations. If 1/3 or less than 1/3 of lip is involved, okay, in that case we go for V-shaped or W-shaped excision, clear, plus primary closure. Now see how we do this V-shaped or W-shaped excision with primary closure. Here you can see carcinoma is involving less than 1/3 of lip, and that's why you can see what kind of excision is done here. Can you see? W-shaped excision. And after this W-shaped excision, you can see I'm going for primary closure. Now see the second example. Here also you can notice that the malignancy is involving less than 1/3 of lip. And here, what is the shape of excision? V-shaped excision. And after this V-shaped excision, we are going for primary closure. Right? Now see the second situation. Whenever more than 1/3 of lip is involved, so the tumor is going to involve more than 1/3 of lip. Here, we go for excision with flap reconstruction. So excision with flap reconstruction, and generally, what is the most commonly used flap? It is Abbé East-Landers flap. So in this patient, you can see this is the malignancy involving more than 1/3 of lip. We are taking a flap from this upper lip. From this upper lip, we are taking this flap. This part is excised, and this part is used for reconstruction. It is based on superior labial artery. Clear? So this is flap taken from upper lip based on superior labial artery. Clear? So this is, what's the name? The name of this flap is Abbé East-Landers flap. So the most commonly used flap, Abbé East-Landers flap, and it's based on superior labial artery. There are two kinds of flap which are used in lip reconstruction. One is cross-lip flap. Classical example of cross-lip flap is this Abbé East-Landers flap, and there is circumoral advancement flap. And what are the names? The circumoral advancement flaps are Karpanzik flap and Webster-Bernard flap. So what are the flaps used for lip reconstruction? First, cross-lip flap, and the second is circumoral advancement flap. So this is circumoral advancement flap. Okay, what are the examples? Here it is Abbé East-Landers flap, and we discussed it is based on superior labial artery. And the circumoral advancement flaps are, first is Karpanzik flap, and the second is Webster-Bernard flap. Webster-Bernard flap. Clear? So this is how we reconstruct the lip. And we discussed that if the tumor is T3 and T4, so apart from surgery, we have to use the radiotherapy. Now see carcinoma tongue. So in this picture, you can see this is the site of malignancy.